Awareness Month. My name is Nicole Byram, and I'm the Health Promotions Manager and Registered Dietitian here with the CCA. And I am so honored to be joined tonight with two very esteemed people. So I'm going to get to their introductions in a sec. So we'll have you with bated breath there. But we're going to walk through a few housekeeping things first. So tonight's webinar is going to be on neurological complications of with celiac disease. So thank you for joining us. Tonight's presentation is proudly sponsored by Shar Gluten-Free. There will be a $50 prize pack given at the end of this webinar, so please stick around, see if your name has been called. That will be drawn randomly at the end. So Shar is a proud sponsor, and watch out for some new Shar products hitting the shelves, such as twin bars, pizza crust, and baguettes. Use the Shar product request form, which will be given to you in the follow-up email to make sure that you can find these products and get them. So they're delicious new items, and we thank Shar for being our sponsor tonight and for every webinar Wednesday this month. Canadian Celiac Association is here to ensure that every Canadian with celiac disease is diagnosed and empowered. This is both our vision and our mission. Oh. My slides are frozen for the moment. Let's see. There we go. Did I skip one too far? The Canadian Celiac Association is empowering Canadians with celiac disease for over 50 years. CCA has been a resource, national advocate for Canadians. Sorry, guys, my computer is really thinking. Okay, let's hope that doesn't do anything.
Nicole, just make sure you've got any other external windows kind of closed up. So yeah. Great.
Okay, I've lost everything here. I'm so sorry. Melissa, can you, sorry, everybody.
You just might have to, Teams will eat up your computer there. So sorry, everybody. Let's see. I can bring up the PowerPoint.
This is not.
It's this is COVID, right? Everything. Do a little tap dance.
I need to get back to Edge though, because that's where my presentation is. What I'm actually going to do is go ahead and introduce. I'm going to stop screen sharing. I'm going to go ahead and introduce our wonderful speakers tonight. So tonight I'm honored to be joined by two incredible people, Dr. Ian Kroll and Sonia Jones. Dr. Ian Kroll is a research fellow from the University of Sheffield in England. Dr. Kroll has a background in cognitive neuroscience, investigating both how a condition may affect the brain physically, as well as how this in turn impacts a patient's cognition and quality of life. Dr. Kroll joined the Sheffield Institute of Gluten-Related Disorders in 2017, has since been involved in a number of high-impact publications, which have used state-of-the-art imaging techniques to study how the brain is affected across the full spectrum of gluten sensitivity. Dr. Kroll's current projects include one that is studying the potential of the gluten-free diet for dementia prevention in people without any diagnosed conditions, but who nonetheless show low-level immunity reactivity against gluten. He's also involved in a new study which will investigate the effectiveness of the gluten-free diet in treating patients suffering with severe neurological problems due to their gluten sensitivity. Welcome, Dr. Kroll. Thank you so much for staying up so late. Dr. Kroll is coming to us from Sheffield, England. So we are really grateful for you staying up so late to share your expertise with our community today. I would also like to welcome Sonia Jones. Many of you may recognize Sonia as a face of our May campaign. Sonia's story has made a huge impact on our community as she navigated the medical system, hitting roadblock after roadblock, searching for a solution to her severe neurological complications. Sonia truly got to a place of diagnosis because she refused to give up. She is an amazing self-advocate and is here to inspire and help others to do the same. Thank you so much, Sonia, for being here today.
Thanks for having me. It's weird to be introduced after a neuroscientist, because when I told people I was on a webinar today with a neuroscientist, I don't think any of my friends believed me, but here I am. So yeah, it's kind of fun.
So Sonia, I would love to have you share a little bit about your story, about your diagnosis journey with our community tonight. It's so moving, and I know everybody who's heard it can't believe your strength and your perseverance. So please share a bit with us tonight.
Well, it's a long story, so I'll try and like narrow it down to the, the highlights. I always start, it's funny, I remember the day so clearly because for me, it wasn't sort of a buildup. I remember being a normal, functional human being. And then literally on October 7th, 2015, I was talking on the phone and I just stopped being able to speak. And I stopped being able to move properly over the course of the next couple of hours. I couldn't read my computer screen. I went to the hospital and they thought I had a stroke. In fact, they sent me home that night. They did a scan on my brain, but they sent me home. And then I was called into my GP's office the next day, general practitioner, so my family doctor. And he said, Sonia, I think you've had a stroke. I need to send you to a bigger hospital. Here's all your paperwork. Go to emergency. This is going to be the fastest way. I'd get an ambulance, but I think Dustin will drive you faster. You should go. And so I went. And that's what started years of investigations where they had no idea what was going on with me. They thought I'd had a stroke initially, and then I was worked up by a stroke team. And it turned out it wasn't a stroke. What they'd seen on my scan was what I've been told is a birthmark, sort of a vascular space in my brain. But I was still having these symptoms. And they said, they do the hospital thing. And I think this is important for everyone who self-advocates for themselves. When you go into the hospital, they'll say, if you feel anything, come back. Well, I came back 4 times that week because I couldn't walk and I couldn't speak and I couldn't, it just kept getting worse. So sort of the next sort of phase of my treatment or investigations was being bounced through neurologists. So I saw a stroke specialist. Then she referred me to a migraine specialist. And then the migraine specialist referred me back to the stroke specialist. Like it was just one of those things. Then at one point they thought I'd had meningitis. It's just sort of a convoluted mess from there. I just was in and out of doctor's appointments constantly for 4 years, really, until I think I had happened what a lot of people have happened. And I don't want to, single out women. I'm sure this happens to men as well. But when doctors can't figure out what's wrong with you, then they think that it's psychological and they want to send you to go see a psychiatrist and put you on medication. And I just sort of had enough. And I remember sitting in my doctor's office, 3.5 maybe years in, and he had received a letter from my current neurologist. And I'd seen quite a few. They'd gone to moved to the Mayo Clinic. One had retired. One was on mat leave. Like it was just weird. So the neurologist I was seeing was one of the top ones in the province. And he had sent a letter to my primary care physician saying, Sonia is not to see any other specialists until she sees a psychiatrist. I think that this is all psychological. And I cried. And I was really cognizant of like how I was being viewed by my doctors. I really at that point wanted to not seem like the hysterical female. So I really tried not to cry. And I think that there's benefits to both. I mean, if you cry all the time, then they think that you're, unstable. But in this case, my GP had never seen me cry. And so I think it flustered him. And so I was crying, just like sobbing in his office, and he was typing and he goes, I didn't think I could get you in to see another neurologist for a second opinion for months because usually it takes months, but I was really, really lucky. A young neurologist had just opened his practice and he could see me that week. And he had no other patients. So he basically took my whole file and went through it over and over and over and kept sending me emails with questions. And it was actually funny because he was so much more digital before COVID happened. So it was kind of an interesting experience because being dragged around when you're not feeling well is really hard. But he just kept sending me emails and asking me to Google things. And I was like, sorry, like, this is strange. You're a doctor and you want me to Google something? Like, it was quite the unique experience. And, he did telehealth appointments before they were popular. This is back in 2018, 2019, before COVID. And he was sort of a radical, and a lot of other neurologists he rubbed them maybe a little bit the wrong way because he was doing things so differently. But he came up with celiac disease on his list of potential diagnoses behind some other. It was the third on the list of 3. He referred me to a gastroenterologist. And even then, like this is the bizarre part of the story. They have celiac on the list. They refer me to a gastroenterologist, and he wants to do a colonoscopy because he thinks it's a different, autoimmune condition. And he goes, you know what, I'm going to run your blood work. And I think you have to do blood work before a colonoscopy, if I remember correctly. And so he goes, I'm just going to throw celiac on there. We might as well just, do it at the same time. But I'm pretty sure they thought I had Behçet's disease. And so they were going to do a colonoscopy. It was scheduled, like literally it was on the books. And what actually ended up happening is they ran the blood work. It was positive for celiac. And literally that week it was switched to an endoscopy. And that's how I was diagnosed. So long story short.
Amazing. And it was a 4-year journey from beginning to end, and 4 years of quite severe symptoms.
Yeah.
So, and then how soon after you were diagnosed did you start to feel better?
Well, I spent a lot, and I think my case is, I think why people find it so interesting is because, there's videos of me all over the internet where I'm, stuttering and stumbling and all these things and can't walk and can't speak. But I think the thing that sort of makes it also unique is that I was almost bedbound for a lot of those 4 years. So as soon as I got diagnosed, it's like my whole life changed. And I mean, I don't want to, make it this dramatic story where there's a happily ever after. I have the similar things to a lot of celiacs right now, where there's a lot of stuff that's unresolved or maybe damaged a little bit because of being undiagnosed for so long, potentially even more so than the 4 years. They can't really trace back when I was, became celiac. But within weeks, I was literally walking and speaking and moving correctly. I was able to walk my dogs. I was hiking, like my whole life changed. And I think it's just a really big, I think if anything, please use my story to advocate for yourselves. And I think that's sometimes the missing piece, because people think that they have to go through their doctor and the doctor knows best. And doctors do, that they largely, they know a lot of things, but sometimes they don't know everything. And particularly if you're having neurological symptoms, that's kind of off the beaten path for celiac disease. So advocate for yourself. Ask to be referred to specialists if you feel that that's something that you need. In Canada, we have a wonderful medical system, but you can be put on wait lists that are quite long. So call the office and ask to be put on cancellation lists. Be best friends with the secretary in the office. Fight for your diagnosis, because if I had not, I would have been medicated and I would have never been diagnosed. And I wouldn't be here telling my story to everyone. I would be in bed sick.
Yeah, no, and we so appreciate you sharing that story of empowerment and that story of perseverance and strength. And this is why 85% of people with celiac disease go undiagnosed, because they have symptoms that don't match up with those obvious, tip of the iceberg symptoms. So, this is where webinars like this come in so handy. So thank you so much for being here tonight and for sharing your story. And you're going to stick around and you're going to be here for the Q&A at the end if anybody has any questions for you. Now, I saw that Melissa had some of those slides popped up, so I wondered if we could bring those back up and we can just do a couple of the housekeeping things before I introduce the keynote speaker this evening, Dr. Kroll. One of the main things I just wanted to discuss was the housekeeping of the Q&A and the chat. So the Q&A you'll see at the bottom of your screen, those are the questions that at the end of this session, I'm going to ask Dr. Kroll and Sonia. The chat, you can kind of chat amongst yourself. If you want to just kind of chat amongst the other audience members, you're welcome to. Please put the official questions in the Q&A. Everybody is on mute tonight and this session is being recorded. So just wanted to make sure everybody knew that. And then a recorded copy of this webinar presentation and any handouts and we will have handouts, at the end, included in that email that will be distributed to you in the next couple of days. So thank you so much. We did have a poll question. Let's do that. So poll time, everybody. Melissa's got a poll question for us. She's going to pull up. So how do you describe yourself? Single choice. Person diagnosed with celiac disease, following a gluten-free diet, but not diagnosed with celiac disease. A family member or caregiver or someone with celiac disease or gluten disorder. A person who experiences migraines, headaches, brain fog, other neurological complications. with celiac not following a gluten-free diet, or a healthcare professional here tonight? Let's see what people say. I feel like entering in the Jeopardy music.
Drum rolls. Okay, we got 224, so let's pull it up.
Okay. Okay, so the majority of people here tonight, 75%, are diagnosed with celiac disease. We have a few, 9%, that are following a gluten-free diet. 10% are caregivers. 3% have some neurological complications, and 7 people here are healthcare professionals. So thank you so much, everybody. Majority are people with celiac disease. So good to know for the population of people here tonight. Okay, what was the next?
Oh, we got the next poll. Yeah, hang on.
Oh, another one. Excellent.
Yeah, it's going to.
Okay. Do you experience any of the following? Frequent headaches. You can multiple choice. You can pick multiples here, right? So headaches, migraines, brain fog, forgetfulness, dizzy spells, numbness or tingling in your fingers and toes, or none of the above. I am a caregiver. So those of you who chose caregiver will be, what was that, 10%? We'll be clicking that one.
Let's see, we've got 285 on the event tonight. We've got all right, let's end the poll here. Let's go.
Okay, 41%. Okay, so 59%. Oh, 62%. I'm looking for the highest. 62% brain fog. That's a lot of people. 59% forgetfulness. 41% headaches. Dr. Kroll, you'll be interested in these statistics. 42% dizzy spells, numbness or tingling in my fingers or toes, 49%. Wow, interesting statistics. Thank you, everybody, for participating in that. All right, next slide. So we've heard from Sonia. Thank you so much. So I will now introduce Dr. Ian Kroll. Without further ado, I will pass the mic over to him. Thanks so much for being here tonight, Dr. Kroll.
Thanks for having me. I'm going to start sharing my screen. If I don't get interrupted, I'll assume it's working and going okay. Hopefully that's full screen now.
It's just a little delay. So there you go. Now you're up. So just you'll be a little bit of a delay, maybe given your location.
Sure. Yeah, that would make sense. Yeah, thank you very much to the CCA for inviting me to talk today. You kindly had me talk 2 years ago as well, I remember, in what for me turned out to be the first of many virtual presentations over the last 2 years, which lasted longer than I think anyone expected it to. As has been explained, I'm a neuroscientist in my background. I'm an academic neuroscientist, so I'm not a clinical doctor. I always feel like that's perhaps an important sort of caveat to put out there at these sorts of presentations. But before I joined Sheffield, I was working on projects to do with dementia, and the kind of the linchpin of everything that I've done since my PhD has been to involve brain imaging in the work that I do. So at Sheffield, this is no different. This is the centre that we work out of on the left, and then we have access to these different research MRI scanners on the right. So I'm going to be talking tonight about the research that we do at Sheffield, where we're very interested in how celiac disease can involve neurological complications. A good starting point, I find, though, is to actually discuss how non-celiac gluten sensitivity can also involve neurological problems. We have got a clinic at the hospital we collaborate with, which is actually dedicated to patients such as these. There's a couple of, these are relatively rare in our experience, but they're kind of very important, very pertinent conditions where gluten sensitivity can lead to these conditions which are strictly neurological. You know, these patients do not necessarily have celiac disease, but the issues are still caused by underlying gluten sensitivity. There's a couple of different names we have for these depending on how they present. So on the left is a scan of a brain of somebody with what we call gluten ataxia. Ataxias are kind of a broad term which is given to, you know, there's a variety of causes which make the cerebellum in the brain shrink and shrivel up a lot, the part that's now circled in red. And in gluten encephalopathy on the right, with a different kind of brain imaging we can do, we find a lot of what we call white matter lesions, these kind of very bright patches that appear in the brain's white matter that essentially should not be there. The patients who get these are, often quite debilitated by them, particularly before they're treated. I was quite moved by what Sonia was saying, and I think it echoes an awful lot of the people who come to this clinic. Will have kind of similar experiences. The sorts of symptoms which are experienced by these patients, I can also see from the poll which has just happened, probably won't be too much of a surprise to people here, but the more the cerebellum is involved, the more the issues to do with movement, coordination, and sensation come in. Unsurprisingly, that's what that part of the brain is largely responsible for. And the more that the white matter is involved higher up in the brain in the cerebrum, then we get our kind of presentation where it's more kind of headaches, migraines, some cognitive issues, and kind of foggy brain and forgetfulness as well. So I like to always start with that to kind of reorient the idea that essentially it's not all kind of celiac disease or nothing. The way that we see it is that there's an overall phenomenon of gluten sensitivity, and that can involve the gut, it can involve the brain, and it can also involve the skin as well. But rather than it being kind of really neatly sort of delineated like that, what we see more is there's a spectrum. It can kind of involve just one of these things, or it can involve different systems to different extents as well. And these names which we give to things give this impression of them being, very separate, conditions that don't necessarily have anything to do with each other. But really, that's not quite so much the case. Another relevant thing to bring up, doctors and scientists always like to talk about markers, which we have, which is basically just a fancy way of saying, something we can measure, which can diagnose somebody. The diagnostic process of celiac disease is very well kind of recognized at this point, as I'm sure many people here will be familiar with. There's this villus atrophy that happens in the intestine, but in the blood, we will also see antibodies against tissue transglutaminase. That is specifically transglutaminase 2, and that has pretty much a one-to-one relationship with celiac disease. Dermatitis herpetiformis, which is when we have sort of skin rashes on elbows and knees in particular due to gluten sensitivity, we can very reliably also find transglutaminase 3 antibodies to be present in the blood. And finally, research which we've done over the past decade, it's not quite a one-to-one relationship, but we have started to see that we can detect antibodies to transglutaminase 6. These seem to be kind of overrepresented in patients with these more severe neurological complications. So that's just something for a bit later in the talk to kind of bear in mind for now. So as Sonia has already touched on, I think, very, very well, I always like to talk a bit as well about awareness of the brain's involvement in gluten sensitivity, because needless to say, I don't think the awareness is where it needs to be. So I was interested to look kind of back through the literature to try and find the earliest reference I could, scientifically speaking, that linked gluten and the brain together. I managed to find this article by Cook and Smith from the 60s. And within this article, they reference even further back as far as 1908, when an author called Carnegie Brown apparently discussed having seen 2 patients with what was then called sprue, which is what we now call celiac disease, whose illnesses were also associated with peripheral neuritis localized to the legs. And similarly, Elders in 1925 talked also about a patient with sprue and ataxia and anesthesia of both legs. So, this is a presentation which sounds very similar to what we would call gluten ataxia today. Some progress has been made, thankfully. The best kind of way I can represent this is in the UK, we have these things called the NICE guidelines, aptly called. These are basically kind of the gold standard medical instructions for doctors. You can look up the NICE guidelines for any medical condition and you will find the kind of accepted reviewed evidence for how you investigate and treat different problems. So if something makes it into the NICE guidelines in the UK, that's kind of the real seal of approval for how you should treat a problem. And the NICE guidelines do now discuss for celiac disease that it involves non-gastrointestinal problems, and it explicitly references neuropathy, which is these kind of sensory issues we've been discussing, and also ataxia, which is the balance and coordination and difficulty walking. And they do also recommend testing for celiac disease in people who present with otherwise unexplained neurological symptoms, and again, highlight in particular neuropathy and ataxia. So I think that's quite promising, but going back to what I was talking about at the start of the talk, it's really kind of only one side of that coin, because this is still centering everything around if there is underlying celiac disease specifically. There's the implication there that if celiac disease isn't found, then it's nothing to do with gluten, which is not necessarily always the case. And of course, it also being written in guidelines is one thing, and doctors knowing commonly about it is another thing entirely, as I also kind of continue to find. So to kind of summarize that this is still an ongoing issue, there was this publication I found, which was out in 2019. The authors of this did what's known as a systematic review, which basically means they really methodically went through all the medical literature. And they were trying to summarize what was out there about how often neuropathy and ataxia were reported in patients with celiac disease. So for gluten neuropathy, they found 13 articles which discussed this, and the prevalence estimates were quite wide. It went from 0% to 39%. And for ataxia, it also started at 0% and went as high as 6%. So, you know, in those papers where they're saying 0%, they're saying that 0% of our celiac cohort had neuropathy or ataxia, they're essentially saying in the world of that study, these problems do not exist. You know, those papers would then be taking as, you know, contending that there are issues at all within celiac disease. The authors of the study, I think, summarized, the authors of the review, that is, I think, summarized this problem quite well. They wrote, although these neurological manifestations of celiac disease have been described over the last 30 years in literature, as I've just discussed, it's actually a lot longer than that. There's still diagnostic delays, often resulting in permanent neurological disability. Now, I know that sounds a bit alarming, but it is a very important point, because the brain does not recover from injury like the gut does. It's actually quite bad at recovering from things. We can learn new coping strategies, you know, if someone has a brain injury or a stroke or something like that, but damage is often quite permanent. So there's a much greater urgency to get people on gluten-free diets if it would benefit them in terms of their brain. And the authors then also conclude that such delays are attributed to these ongoing controversies, which arise from some variation in the reported prevalence and poor understanding of use of appropriate serological testing. So even now, there's obviously still this argument going on. So why is there an argument that, you know, when we do have these studies saying there's a problem? Well, on the one hand, the kind of the criticism directed at research, which states, no, there's issues here, we should look at this, is that they suffer from some form of bias or other. And that bias is usually cited as being that the people who run those studies run them from very specialist centres. And it's a fair criticism. I'm not meaning to sound defensive on this. It's an important thing to consider scientifically. So, you know, if you're part of a research group that's really motivated to investigate this, it probably means that you're seeing a lot of patients who present with these issues, and you could probably then argue that those patients may not be representative of celiac disease at large. So, you know, it's not valid in a way. But on the other side of the argument, you can say, well, research saying 0% is lacking the right sensitivity to, you know, detect what's really going on here. And one way of kind of summarizing that would be to say, well, neuropathy and ataxia to clinically relevant levels are actually quite blunt and quite severe problems. We know that there's a wide spectrum of neurological health that exists before you can get as bad as needing a neurological referral. And, you know, if the research group you're doing is only interested in saying, do they have an outright full-blown ataxia diagnosis, you're going to miss a lot of variation there. So the first experiment I want to discuss is actually one that I presented 2 years ago as well. So I won't spend too long on that for anyone in the audience here who was there as well, because I'm sure you will have been hanging on to my every word back then. But this was still an important experiment to kind of lay the groundwork there, where we really tried to validate the issue and address these potential areas of criticism. So we used a resource we have access to in the UK called the UK Biobank. This is a gigantic scientific undertaking, which I think it's the University of Oxford who kind of runs and is in charge of. And in the late noughties, they recruited 500,000 adults from the UK of all healthcare backgrounds. Like literally the only inclusion criteria was that you had to be an adult in the UK. And 500,000 of those, and collected all sorts of healthcare data relating to them and demographic information as well. Then more recently, they've been inviting back, and they aim to do this to 100,000 of these patients to undergo all sorts of MRI scanning and other kinds of testing as well, including cognitive testing too. The idea being that, you know, inevitably within so many people, a lot of people will have dementia, Parkinson's, or forms of cancer or celiac disease. You know, you can be a researcher interested in whatever condition it is, and for a small fee, you can get access to this, and now you have a data set to work with people who have celiac disease and brain imaging available as well. So this is what we did. We got access to this, and we wanted to do a study on the celiac disease patients within the biobank, knowing, of course, that this is completely independently collected data away from our grubby hands. And of course, because it's a definition of a population study, these will be as representative of celiac disease as possible. So the question becomes, can we still see neurological type findings using other people's data? So we looked within all the data which we had at the time. There was about 28,000 scans we got. That's of all the scans that were available. Within that, 104 of them were of people who had celiac disease, who were also otherwise completely healthy, no neurological history. And they also weren't taking any kind of brain-altering prescription medication either. And we matched them to healthy controls who had all the same criteria, except they also didn't have celiac disease. And we matched them on a range of different things to try and really kind of control for as many factors as we could. We then just conducted a series of what we call like Groupwise analyses, which is comparing scores between the two groups to see if there's any evidence that celiac disease group kind of underperformed or showed any signs of issues compared to the controls. So these included scores from 5 different cognitive tests, 2 different questions which explored aspects of mental health. And we also did some brain imaging analyses which centered on a kind of MRI scan called diffusion tensor imaging. If anyone's seen me talk before, I use this particular spinning image to death, so you'll be sick of this, but this is a DTI scan of the brain, and I've mentioned the white matter a couple of times. What the white matter in the brain really is, it's kind of like the wires in the brain that connect the different thinking regions together. And of course, you know, if there's any kind of injury to the brain's wiring, that can be just as much a problem as injury to the thinking parts. And it really does look like wires. You know, when you get a scan of it, you get this image of kind of all these fiber tracks running through the brain. And this is what DTI scans are very good at imaging and also kind of quantifying, so we can get numbers from it which are really sensitive at telling if any small subtle changes have happened to it. Sure enough, when we looked at the results, we did find a number of findings here. So the people with celiac disease were significantly slower on a reaction time test. I should say at the moment, I'm going to use the word significant or significantly quite a lot, and that's just a habit as a scientist. I don't necessarily mean that in kind of like an emotive, real world way. It's kind of a way of mathematically describing that a result is kind of official, if you will. It kind of passed the statistical tests that we did and is now something we can report as a real finding. So that is true of a reaction time test. And there are also a number of significant findings on these questions to do with mood and quality of life. So people with celiac disease were more likely to answer questions which indicated anxiety, depression, thoughts of self-harm, and perhaps not quite so surprising in this last one, they were significantly more likely to be unhappy with their own health as well. And then coming on to this brain imaging analysis, we did indeed also find changes here. So, you know, in contrast to the things I've just been discussing, which are kind of outcomes of the mind, these are now showing physical changes, you know, in the tissue of the brain between the two groups. So what we're looking at here is kind of a template image of the brain. Anything in green is a white matter tract that is the same between two groups. But any of those areas which are superimposed on top in a kind of red to yellow color are parts of white matter tracts where we found different measurements in the celiac disease group compared to the controls, which we interpret as being a sign of some sort of injury which has occurred in those regions. So that study, it got published, not to mean this in a bragging sort of way. I was very happy that it was published in a good journal. And we took that as quite a heartening sort of sign that, you know, what was once quite a contentious topic is hopefully getting good exposure now and is maybe being picked up a bit more into the mainstream. So I'm now going to move on to kind of the obvious next question. So, you know, how frequent are clinical symptoms in patients with celiac disease? And also what might predict risk of celiac disease patients who are more likely to experience them compared to others? So this is a different study which was published a few years ago. We recruited 100 patients with newly diagnosed celiac disease straight from the gastroenterology department. So these patients were recruited at their time of diagnosis. So kind of the motivation behind all this is, you know, this is the earliest point in somebody's disease course that we as doctors and scientists can really interact with someone who has celiac disease. And also, again, none of them had any neurological history. So that's kind of the effort there to make sure this is a valid, you know, group where you can generalize these people with celiac disease to what is typically found. And we just did a neurological characterization of them. So a consultant neurologist just kind of examined them. We did some brain scanning, and we also tested their blood for this kind of new antibody I mentioned earlier called transglutaminase 6. This next slide, I feel has essentially already been spoiled by that poll that just happened. There's quite a lot of overlap here. So this is just what was noted in, you know, percentage-wise across these patients. So on the left is what the neurologist noticed, which was that 10% of them had signs of peripheral neuropathy, which is these kind of sensory problems. 29% were noted to have some level of difficulty walking, and 11% had something called nystagmus, which is a kind of a neurological sign where your eye can twitch in a way which indicates a potential problem. And then these mirrored quite well what this group of patients self-reported as well, where a quarter mentioned balance problems, 12% said sensory symptoms, and, you know, just under half complained of frequent headaches. And a kind of a headline summary I always use on this slide is that even when you exclude the headaches, you were still left saying that exactly half of the cohort had at least one sign of something that's potentially a neurological problem. So what I then wanted to do was to look at this TG6 thing. So just to reiterate that again, TG6, what I mean here is that these are kind of blood test results where we find if somebody has TG6 antibodies or not. And as I kind of alluded to earlier, it's not a perfect diagnostic test by any means at all, but we do seem to think that it has some role to play in the diagnosis of people with full-blown gluten ataxia. So we wondered here if a celiac disease patient who also had TG6 may be at greater risk of neurological issues. So the main analysis we did for this was to first of all look how many of the group had TG6, and 40%, so 40 of the 100 did. And we then compared that 40 who did compared to those 60 who didn't. And we did this in a brain imaging analysis where we used structural brain scans to measure the volume of different brain regions, which we thought might be relevant to the sorts of symptoms we know happen in these patients. And sure enough, we found that subjects with TG6, on average, had significantly lower brain volume in the grey matter of the cerebellum, and also in part of the subcortical grey matter, which really came down to a part of the brain called the thalamus. And the thalamus is a region of the brain that kind of accepts incoming messages from the cerebellum. So those two are connected. And as it happens, they're actually connected by the tract which was implicated in the UK Biobank analysis most. So there's some sort of synergy that's going on there. The next most obvious question is kind of to ask, well, you know, how do these symptoms change over time, and also, you know, what help does the gluten-free diet provide? I've been slightly cheeky up to that point because these two studies I just discussed were both things I presented before, but this is all completely new now. So experiment 2.5 is so called because this is a very recent follow-up study which we did on those patients who attended a number of years ago. So 30 of the patients I was just discussing re-attended for follow-up measurements recently, which was an average of 7 years after that initial assessment. And we basically did the same set of testing on them a second time around to see how things have changed in the meantime. In terms of the imaging, these are important points for kind of scientific accuracy. You know, we made sure that everyone was measured on the same scanner the second time around with the same sequence so that all the data is comparable between the follow-up and the baseline points. And as the baseline information had already kind of shown that the cerebellum and the thalamus were regions of interest, we kind of recalculated the brain volumes of those now 7 years after the fact in these patients. And after those volumes were kind of recalculated, you can kind of further divide that by the actual time that's passed between the two scans. So you can get a yearly percentage volume loss of that region. Of course, in healthy aging, sadly, we expect everything to shrink over time anyway, but if something's shrinking faster, that could still be, you know, a sign of an issue. So important point is that exactly half of this 30 had achieved negativity of all gluten-related antibodies, which we could test for when they came in for that follow-up appointment, which is, you know, really this is what we're hoping can be achieved when someone goes on a strict gluten-free diet and that diet is very successful. You know, they've become immune negative to gluten and the body is kind of calm and at rest. You know, this is what we want. In terms of looking at how symptoms have changed over time in their prevalence, it's a real mixed bag. I don't want to dwell on this slide for too long because it's really difficult and unscientific of me to try and draw kind of information out of this. We kind of see some things apparently improve, some things apparently get worse, and other things stay the same. It's difficult to kind of draw meaningful conclusions out of that. You can try and look into the data a bit further. You know, we were able to make the observation that all patients who had kind of developed ataxia signs over the meantime were ones who were still positive for gluten antibodies. So that could potentially indicate, you know, that they've had an ongoing immune problem which has led to this. But this isn't a statistical analysis, and scientifically we need bigger, more data to kind of really comment on that. However, we could then do this brain imaging analysis where I compared the yearly rate of atrophy of both the cerebellum and the thalamus between those who had achieved immune negativity and those who were still positive for at least one antibody at follow-up. And nothing was found in the thalamus, but again, sure enough, for the cerebellum, we did find that those who had achieved immune negativity had significantly lower brain volume loss in the cerebellum year on year compared to those who hadn't. So people who were immune negative lost 0.32% the volume of the cerebellum every year. Those who were still positive for an antibody lost 0.73% of the cerebellum every year. So I think this is actually a very important slide because it kind of really demonstrates in kind of raw numbers, you know, that a successful gluten-free diet is protective of the brain. You know, this kind of indicates really that there is a protective effect to be gained there. Lastly, I also just wanted to briefly discuss cognition, you know, because this is also about the mind as well as the physical brain. So there have been a few studies, you know, which have been done showing how cognition can be affected in people with celiac disease by a number of different people. This is one, which we also published a couple of years ago now, where we recruited 19 people with newly diagnosed celiac disease with 21 healthy matched controls. And we also recruited a third group, which was kind of the novelty of this particular analysis, of 35 people with very established celiac disease who are an average of 12 years after their initial diagnosis. And we essentially just did a range of cognitive tests on these people, and the cognitive tests all kind of belong to what we call different domains. So, you know, different kind of cornerstones of how we think, just to kind of look at how the scores compare between the groups. there's some gobbledygook on the bottom of the screen. I apologize for about the stats involved. So we did find, again, this word significant, meaning, you know, the statistical test says, yes, this is relevant. We did find that in 2 domains, visual memory and verbal memory, the celiac groups were kind of worse at performing these tests compared to the controls. And they were worse, it's important to say, in a pattern where whether you're newly diagnosed or 12 years after the fact, they're kind of comparable to each other and they're kind of equally underperforming compared to the control group. And just to kind of put something to what those tests are in visual memory, we kind of show this weird picture and say you have to remember this now and 30 minutes later. And for verbal memory, it's a similar thing. Remember whatever it is, be it a short story or a list of words now and also 30 minutes later as well. However, in a third cognitive domain, what we call visuoconstructive ability, we found a slightly different pattern where newly diagnosed patients with celiac disease performed really comparatively with the control group, but patients with established celiac disease performed worse than both of those. And visuoconstructive ability is, again, just kind of putting shapes together. So that weird picture I just showed, not the part where you have to remember it, but just the part where you have to copy it. And also this other thing called block design, where you kind of have to make these geometric shapes out of these different blocks. So to summarize that, you know, this is again a study where we did show that cognition is affected in people with typical celiac disease compared to controls. Again, reassuringly, this does for the most part appear to be set at the point of diagnosis, which kind of again implies a protective effect from the gluten-free diet. You know, once you start treatment, it kind of plateaus and stabilizes. However, we did get this one finding with the visuoconstructive ability, which perhaps similar, you know, to these questions about different antibody groups, implied that some things may continue to deteriorate a little bit. Of course, what we really need to do is to be able to repeat analyses like this alongside data about antibodies and serological test results and continue to tease these things out. I'm coming to the end of the talk now. There are a number of studies which we're still working on at Sheffield, which are really trying to look into exactly all these sorts of things. So I can't say much more on these kind of questions at the moment, but it's absolutely a watch this space sort of thing. So just to bring it all together, you know, yes, the brain is affected in celiac disease and also elsewhere in gluten sensitivity. There are studies you can do using population data which helps validate this, and I'm really hoping this is becoming more of a mainstream thing now. Sounds like you all already know what symptoms to expect, but headache, brain fog, sensory issues and coordination problems can be found, which can be, you know, either relatively milder in celiac disease, but it can be on the spectrum. It can get worse as well in certain patients. And yes, there is evidence that a gluten-free diet helps ameliorate and stop the progression of these problems, but more ongoing work is happening there. So thank you very much again to the CCA for inviting me to talk today. Thank you all for listening. I'd also just like to thank my colleagues here in Sheffield and the various different research bodies which have helped fund all the work which I've presented today. Thank you very much. I will stop sharing my screen.
Thank you so much, Dr. Kroll, for that information. That was fascinating, as always, to listen to you speak. So we've got a number of questions, which I will get right to. One off the top. So when somebody goes on a gluten-free diet and the neurological symptoms improve, is this due to healing from the brain, or is it a reorganization of the brain pathways?
So I think there's kind of 2 levels to that. I think when we're talking about neurological issues in celiac disease, a lot of what we find can seemingly resolve very quickly. You know, kind of as Sonia was saying, you know, you're kind of in a sea of horrible sensations and problems, and then it's like a cloud that lifts, you know, once we go on the diet. So there's clearly you know, a very immediate effect of that. And the obvious interpretation to take is that a lot of those symptoms are caused not necessarily by brain damage that has happened and is permanent, but by these kind of temporary processes that are going on and affecting the brain. You know, that can be sort of levels of inflammation in the brain that can then subside, or, you know, just stress throughout the body. To be honest, it can be a number of different things, and to be honest, we're not entirely sure about that. I've had a lot of conversations, even just this year, with people about, particularly brain fog is the one that always seems to come up, and, you know, what really drives that. And it can be blood flow, it can be all sorts of different things. We're honestly not sure. So a lot of those symptoms, I would hesitate to say are caused entirely by, you know, brain damage, which can sound like a very serious kind of thing. But then, you know, there is that as well underlying, and I think this is a question of, you know, how long has the exposure been to it. You know, I think we have this idea that the longer the exposure is over time, perhaps things will just kind of continue to accumulate a bit in the brain, and there will become a point when those changes are kind of more permanent in nature and don't really heal. At that point, there are these coping strategies, which the person asking the question alluded to. You know, the brain can try and work around it, reorganization, or, you know, we can learn new skills, we can learn little tricks to help with problems we've developed. But that is kind of what it is. It is kind of working around a problem that will sort of stubbornly still sit there in the brain. So again, you know, this is really the motivation of a lot of this, is get the diagnoses in as quickly as possible, and get the gluten-free diet started when it needs to be started.
Yeah, so as early diagnosis as possible. So for somebody with gluten ataxia who doesn't necessarily have celiac disease, the presence of TG6, that is not diagnostic for celiac disease, it's just possibly an indication, or you're looking at it in conjunction with gluten ataxia and neurological complications with celiac disease. So it doesn't necessarily mean a diagnosis, but it is more likely to be increased in somebody with gluten ataxia. Is that right? That's
correct. Yeah, it becomes part of this. You know, we like everything. In an ideal world, everything would be a very clean one-to-one thing. You know, it would be nice, oh, you've got this, so therefore you have this as well. TG6 seems to be more part of the bigger picture. The doctors who make these diagnoses will take the existence of TG6 into account. I think TG6 occurs in 70 to 80% of people who have gluten ataxia, so it's quite a high rate. But then there's other things going on as well. So I haven't discussed at all. There's gliadin antibodies, which you would normally expect to also occur, and then it's also partially a diagnosis of exclusion. There's a brain imaging test called a spectroscopy scan, where you measure the level of metabolite somewhere in the cerebellum, and that's part of it too. At the end of it, you've got the specialist sat there kind of bringing all of this together. And then the response to the gluten-free diet becomes part of the confirmation on top of that too.
Okay, so Kathy's asked, please indicate if this is being recorded. So yes, this has actually been asked by a number of people. So for those of you who are wondering, you will be getting a recording of this emailed to you in your inbox in the next couple of days. So if you'd like to watch Dr. Kroll again and take notes, you will be able to do that. Karen asks, is the only way to treat ataxia to eat a gluten-free diet?
Currently, sadly, that is the case. You know, that this is, like celiac disease, it's the best treatment we have at the moment. That is the short answer to that question.
Okay. Mary Erickson asks, how much damage can undiagnosed celiac disease do? I've been diagnosed with celiac disease with SUNCT and also ALS bulbar, doing gluten-free and dairy-free diet now. So I guess what Mary's wondering is, can an undiagnosed celiac diagnosis, or somebody with undiagnosed celiac disease, can it lead to these other conditions?
Well, I mean, this is one of the things that I think we worry about, basically. I think for most people with celiac disease, not always, but it tends to be, you know, have some of the gastrointestinal stuff going on in it. You know, we hope that we're relatively good at diagnosing that now. I say we, again, I'm not a clinical doctor myself, I'm more sort of talking about my colleagues there. And so, you know, if you have that almost as an early warning sign, then you go on the gluten-free diet as soon as that happens in an ideal situation. And it's interesting that the average age of adult celiac diagnosis is about 45, if it didn't come on during childhood, that is. And then we also just notice that patients who we see with the more severe neurological issues, who do not necessarily have celiac disease, tend to present about 55, so about a decade later. So it's been a bit of a pet theory, which remains to be properly tested. But, you know, what if the immune reactivity came on at the same point in life, around 45, but it's just more quickly noticeable for somebody where it expresses through the gut, and then the celiac diagnosis happens and gluten-free diet happens. So they get kind of a 10-year head start on starting the diet, and then 10 years later, the people who haven't had that benefit, we can see these more serious neurological problems. And, you know, I'm not trying to kind of oversell it here, but, you know, in the absolute worst cases, these people are extremely debilitated. And, you know, my colleagues like Marios have got a number of horror stories of people who've been, you know, shipped around lots of people, never getting the right diagnosis. Going on the gluten-free diet winds up really helping them, but at that point they're in a wheelchair, and they will be for the rest of their life, you know, from kind of how bad the ataxia is. I think things like that are relatively rare. You know, this isn't kind of the 1 in 100 that, you know, celiac disease is, but it's there, and it's very important to consider too.
Somebody along those same lines further down the question list asked about the relationship between celiac disease and MS as well. So along kind of that same vein.
And MS was that?
Yeah. Yes. Yeah.
Yeah. There's a number of other neurological diagnoses where I think, you know, there's these little hints that there may be links, but it's perhaps a little bit more contentious. So epilepsy is also another one which comes up quite a lot. When you go into the science of it, these things tend more to be in kind of case studies than sort of large reports, which doesn't mean that there isn't a link. It just makes it a bit harder to assess. So it's honestly not something I feel I can really comment confidently on, to be completely honest about that.
Absolutely. Stephanie asks, I've suffered with severe chronic migraines and 10 years with an MS diagnosis. I'm currently going to have an appointment in Ottawa for stem cell treatment, and I'm becoming weaker and weaker despite being on strong multiple sclerosis meds. Does having brain lesions or flares with gluten sensitivities / celiac, does anyone have brain lesions or flares with gluten sensitivity and celiac? So I guess the question is, do people with gluten sensitivity, celiac disease have brain lesions in accordance to? So I know that you've talked about white matter and shrinking, but are there lesions seen as well on brain scans?
I mean, the short answer to that is sort of, to draw a comparison. So both MS and celiac disease, I mean, MS, as the person asking the question will probably be familiar with, involves white matter lesions, which you get on a kind of brain MRI called a flare scan. In MS, they appear in a particular sort of pattern, which is particular to multiple sclerosis. Those same sort of blobs are also what we can see in neurological expressions of celiac disease. That is, they kind of appear on the same scan, but they wouldn't appear necessarily in the same pattern. And they're also a very generic finding. These are things we all get as we get older. You know, I've had a number of scans myself, and I keep looking out for my first one, you know, whenever that's going to appear. So it's kind of deceiving to say, yes, they're there in both, because that really needn't imply that they're from the same cause. It will not be as straightforward as that. And I'm sorry, again, I don't really feel like I can comment too much more on that, else I'm veering into kind of the medical advice side of things that I'm not qualified to discuss.
No, absolutely. And interestingly enough, the next question involves MS as well. But just a parent asking, Joanne asking, I think I have undiagnosed celiac disease and need to follow strict gluten-free diet. My 32-year-old daughter has been diagnosed with MS. Can she possibly have celiac as well? So, you know, my recommendation, and Dr. Kroll, I'll certainly let you speak after that, but as a dietitian, I would be certainly saying both of you should go be screened for celiac, get your blood work done, and if it's elevated, get your biopsies done. So both of you would just have to be on a gluten-containing diet to make sure that the PTG antibody would be present in order to be accurately tested for. Dr. Kroll, would you have anything to add to that?
No, I think that covers it. Get the test done, absolutely worthwhile doing. And you know, even if it comes to it as well, you can always try a gluten-free diet and see if it helps you in your own life. If it does, there's no reason not to continue that as well. Yeah.
On that note, TG6 antibody test, is that readily available for people or no?
It's not, I'm afraid.
Okay.
It's a recently developed test.
Okay.
I think we're quite unique in our centre, I think, because we're part of the team along with people at Cardiff University who helped develop it, in being able to order this test for patients. So a lot of the ongoing research I've referred to, it heavily involves TG6, and as this comes out, of course, if it continues to prove useful, the hope is that it will become more widely adopted.
So for people with a negative TTG antibody standard test here in Canada who have gluten ataxia and want to get that TG6, they'd have to fly to Sheffield to get part of your program.
Yeah, it's not something I'm going to recommend, I'm afraid.
Yes, no. Would be certainly interesting because, yeah, that's the future.
There may well be some avenues in North America, but I'm not aware of any myself, I'm afraid. I think it will be very experimental at the moment.
Okay, so anonymous person asks, I think she means I'm always cold, even when no one else gets cold, even when it's summer out or hot. Our daughter is pathology confirmed celiac, and despite fears of gluten-free diet, has nausea and only controlled with Zofran. So maybe is being cold. Anonymous, I'm not quite sure what you're meaning with this question. If you could rewrite it, that would be fantastic. If your daughter is pathology confirmed celiac disease and your question asking about yourself, I would suggest all first degree relatives, our recommendation is to get screened for celiac disease, so that siblings, parents, and children do get screened for celiac as well. That's again the TTG that you get done and a serum IgA level. Just a lab here in Ontario right now. Until next year, end of March 2023, it is free to get that done, and on all other provinces and territories, it is free as well. So please do get that done if you're concerned about it. Teresa asks, I'm from Galloway, Ireland. Why are there so many celiacs on the west coast of Ireland? Do you have an answer for that?
I don't know. I'm not sure if that study's been done, I'm afraid.
Teresa, I know that definitely it appears that way. Sorry, Sonia, were you going to say something?
Sorry, I was just reading the previous question. I can't answer it from a medical standpoint because clearly I'm nothing like that. I can just say that I've been told from doctors that being cold can be directly related, because I'm always cold. So maybe I'll just share my experience.
Yes.
I'm cold all the time. And I was told it was due to my low blood pressure, which is also related to my celiac complications. So that might be a possibility. So just, I know that that's probably, if she's cold all the time, I'm always like, I'm freezing, but yeah, that's why it's my low blood pressure and I have trouble keeping warm. So. Okay.
Well, that's great. Firsthand experiences are always good to hear for sure. And, speaking to, I'm scrolling through here, where is she? About the Galloway, Ireland. Coverage is 1% of the population globally. I think some countries might do more screening than others, possibly. So that could be why it appears that way. TG2 antibodies show up in a blood test if you hadn't had, TG2 antibodies show up in a blood test if you haven't had gluten for 14 years. So Linda, no, the answer to that will be no, they won't. The goal, of course, when you go onto the gluten-free diet is that your TG will come back negative. So for example, my daughter just got her TG levels tested again. She's been diagnosed for 7 years and they came back less than 0.05. So that is fantastic. My husband's last time came back at 0.4. So we do want to see those numbers go down. If you have no gluten in your system, then they will appear negative. If you don't have the protein in your body, then the antibody is not going to be produced. So that is that. Anne asked, after 15 years since diagnosis and adhering to a strict gluten-free diet, is it possible to have ongoing neurological symptoms? So Dr. Kroll, I'll give that one to you.
I think, from experience speaking to different people and some of the patients that I hear about, I think it can be, it's kind of a bit of a lie to pretend like it's as straightforward as this. You know, you can always find people who are very frustrated, you know, who are on a really genuinely strict gluten-free diet that they're throwing their all into, and you know, are suffering some ongoing symptoms in spite of that. I know that, you know, for some of these patients with gluten ataxia, you know, most do respond very well to the gluten-free diet. So some continue to have issues, and I think that the doctors kind of start to use more kind of, you know, impressive medication, if you will, you know, kind of immune suppression at that point, from what I understand. So I think for the most part, these are relative sort of edge cases, and we don't understand them as well as we should do. You know, these are all parts of what we need to continue trying to understand better.
And that's asking about B12, riboflavin, and B6, but I'm going to specifically ask about B12. Can a B12, like a pernicious anemia, can that be complicated or appear like a gluten ataxia?
So I have a sense that B12 issues can affect the brain, but I'm afraid it's not my field. It's not something that I can kind of answer with any real confidence there.
Have you any information on children with celiac disease experiencing auditory hallucinations?
No, I do not have experience on that, I'm afraid.
Is there, this will be right up your alley, and is there a link between celiac disease and dementia?
So there's kind of one study to look at that kind of really tries to ask this question. There was a study which used what we call epidemiological data from Sweden, which basically just means when they have a huge number of cases to look at. So I think they were able to get public healthcare data from Sweden. And they had about 8,000 people with celiac disease, and they compared them to about 40,000 controls. And, you know, they just kind of looked at the years after diagnosis and the same number of years in the control group to see what the risk of developing dementia was. For pretty much everything, the celiac disease group did not show an increased risk compared to the controls. However, there is one subtype of dementia called vascular dementia, which is not Alzheimer's disease, but it's kind of rather caused by, people often talk about it's being caused by kind of lifestyle factors like, look, you need to look after your heart, you know, you need to look after your blood vessel system and blood pressure and weight and things like this. People with celiac disease did suffer an increased risk of going on to develop vascular type dementia. Vascular dementia also involves white matter lesions in a similar pattern to what we see in celiac disease. Things I've not discussed include antibodies involved in the gluten response that show reactive properties with blood vessels that supply the brain. There's various possible kind of mechanisms there by which that might be plausible. So there is potentially a link with one type of dementia, but this is also the most preventable type of dementia. This is kind of what it's known for. You know, it's the one where interventions can help. So again, you know, it just keeps coming back to that message of gluten-free diet in a timely fashion, follow it well. This should help, you know, a great deal.
Right. Get diagnosed early and stick to the diet. Somebody's asking if TG6 levels go down after a gluten-free diet's initiated. They go down or do they stabilize?
They go down. Yeah, it's the same down. As with TG2.
Okay.
The objective is for them to become negative.
I'm aware of our time. We have 4 minutes, a quarter after, and then we'll call it. Has there been any research on the comorbidity of neurodevelopment disorders such as specific learning disorders or ADHD and celiac disease? Do you have any experience with that?
A little bit. So in terms of kind of other psychological and you know, kind of these learning disorders as well, there are a couple of links which have been found. So celiac disease is associated with increased incidence of anxiety and depression. I think ADHD as well, and also there is kind of an overrepresentation of people with autism spectrum disorder as well. There's an overlap there too. Quite why this is the case in all these instances, we're not so sure. You know, when you talk about anxiety and depression, the obvious thing to ask is, well, you know, someone who's living with quite a stressful condition like celiac disease in a rational sort of way may well be more likely to feel stressed and pressured by that. So that's not necessarily meaning there has to be something physiological going on there, although there could be. And then for things like autism spectrum disorder, really the most that has been shown is, again, these kinds of studies where you can kind of show that, you know, if you have one, you're more likely to have the other than you should be, you know, all other things being equal. And again, why that's the case is kind of up for debate still.
Okay. Okay, one last question. I'm 38 and a brain MRI revealed I have around 30 white matter brain lesions. Could this be caused by celiac disease?
Yes, it could be, but as I kind of alluded to earlier, as a finding, it is quite, you know, taken in isolation. If the only thing you know is that here's a brain scan and there's white matter lesions there, there could be a number of reasons why that's there. So that absolutely is something which, you know, hopefully a good neurologist and neuroradiologist is looking into for you.
Well, for anybody having neurological complications related to celiac disease or not, would your recommendation be to get a referral to a neurologist?
Yes, I think it always would be. You know, if that's something which you're able to do, if that's something which you can have arranged for you, if you're having neurological issues, you should see a neurologist. And, you know, it remains true. I think a lot of healthcare professionals are probably not as kind of cognizant of these things as they would be in an ideal world. So as Sonia was saying earlier, go into those meetings being your own advocate as well. How to do that in the right way, you know, you worry about rubbing some doctors up the wrong way if you try and seem like too much of a know-it-all or this, that, or the other. But, you know, if you're going in with an awareness of this as well, and you can bring it up, you know, particularly if you can kind of show, I don't know, some studies which kind of support what you're trying to say. If you printed something out, you know, from medical literature, it's worth doing that as well.
Okay, wonderful. Well, thank you so much. Thank you, Melissa. You've just pulled up our upcoming May event. So thank you to both Sonia and Dr. Kroll for joining us here tonight. Fantastic conversation, and just reaffirms the CCA's message to, you know, get screened, get diagnosed, and to make sure that you follow that gluten-free diet. So we've got some really exciting upcoming events. This May, as I mentioned, this is Celiac Awareness Month. So this Saturday, you have an opportunity to cook along with me in the kitchen. We're making French toast with Promise Gluten-Free is sponsoring that. And I have a $75 gift basket from Promise Gluten-Free to give away on Saturday. So please come and try to qualify for that gift basket. And it's an interactive session capped at 30 people or 30 registrants. So we can have a chance to chat. So you can ask me all kinds of questions. If you didn't get a chance to ask questions tonight about the gluten-free diet, I can take your questions on Saturday. And then, of course, every Wednesday this month, we have our webinar Wednesdays. So next Wednesday is the link between IBS and celiac disease. We've got Dr. Inez Pinto-Sanchez coming and a dietitian, Megan Donnelly. The following Wednesday is iron deficiency anemia with myself and Dr. Scully. And then the last Wednesday of the month is mental health and celiac disease. So I really encourage people to come to that. That is with Dr. Sarah Ahola-Cahoot from Sick Kids in Toronto. Don't forget, May 15th, we have a very special Gluten-Free 101, getting started on the gluten-free diet, hosted by myself and Linda Nielsen, who is apparently watching this from Italy in the middle of the night. And she will be hosting from Italy as well, telling us about her world travels. So looking forward to that. And then May 16th is International Celiac Awareness Day. There'll be light up events happening all over all over Canada. So join myself. I'll be here in Vancouver with our BC chapter, lighting up Science World in BC Place, and Melissa will be in downtown Toronto, lighting up the Toronto sign. So we will be all across Canada representing and shining a light on celiac disease. The last Sunday in May will be our last cook along, our last event, and I will be cooking a plant-based meal, Southwest Veggie Tortilla Wraps. So please sign up at on our website, www.celiac.ca, and sign up there. So thank you so much, everybody. There were
Don't
lots
forget your
of
SHAR
questions.
prize. Don't forget your SHAR winner.
Oh, our SHAR prize. Thank you. Our SHAR prize, our name was drawn, and it was where did I write
It
down
was
her?
Carol from Canada.
Carol from Canada. I found the page. Thank you.
And
Congratulations,
Dr. Kroll
Carol
was
from Canada.
Dr. Kroll was amazed that we have Canada in Canada.
Fabulous. So congratulations, Carol. I hope that you enjoy your $50 prize from SHAR. They will be shipping it directly to you. So thank you so much. Okay, everybody, thank you so much to our speakers. Amazing. So the questions that we didn't get to, we've got them, and we will try to answer them after the session. Thank you so much, everybody. Have a great rest of your evening.
Thanks very much again.
Thank you.
Bye-bye.